Hepatitis A is a viral infection that affects the liver, caused by the hepatitis A virus HAV. It is usually transmitted through the ingestion of contaminated food or water. Hepatitis A is an acute illness, meaning it generally does not become chronic, and most people recover fully with supportive care. Transmission hepatitis A is primarily spread through fecal-oral route. Consuming food or water contaminated with fecal matter from an infected person. This is common in areas with poor sanitation. Close contact. Direct contact with an infected person, particularly in settings where personal hygiene is inadequate. Contaminated food or water. Eating raw or undercooked shellfish from contaminated waters, or drinking water that is not properly treated. Sexual contact. Engaging in sexual activities with an infected person, particularly in practices that involve oral anal contact. Symptoms of hepatitis A can vary and may include fatigue, feeling unusually tired or weak, abdominal pain, pain or discomfort in the upper right side of the abdomen where the liver is located, jaundice, yellowing of the skin and eyes, indicating liver inflammation, nausea and vomiting, feeling sick to the stomach and possibly vomiting, loss of appetite, reduced desire to eat, dark urine. Urine may appear darker than usual. Light-colored stools. Stools may be pale or clay-colored. Joint pain. Some people may experience pain in the joints. Diagnosis: hepatitis A is diagnosed through medical history and physical examination. Review of symptoms, recent travel, and potential exposure to the virus. Blood tests. Hepatitis A antibody test IgM detects the presence of antibodies indicating a recent infection. Hepatitis A antibody test IgG indicates past infection or vaccination, as IgG antibodies remain long-term. Liver function tests. To assess liver damage and function. Treatment: there is no specific antiviral treatment for hepatitis A. Management focuses on relieving symptoms and supporting the liver. Rest. Adequate rest to help the body recover. Hydration. Drinking plenty of fluids to prevent dehydration, especially if there is vomiting or diarrhea. Diet. Eating small, frequent meals and avoiding alcohol and fatty foods to reduce strain on the liver. Medications. Over-the-counter medications for pain and fever, but consult healthcare provider before taking any medication, especially if the liver is affected. Prevention: preventing hepatitis A involves several measures. Vaccination. Hepatitis A vaccine, the most effective way to prevent infection. Recommended for all children at age 1 and for adults who are at risk. Good hygiene. Hand washing, regularly washing hands with soap and water, especially before eating and after using the restroom. Safe food and water, ensuring food is cooked thoroughly and drinking water from a safe source. Avoiding contaminated food and water. Being cautious with food and beverages, especially when traveling to areas with poor sanitation. Avoiding close contact. Taking precautions to avoid close contact with an infected person if you are not vaccinated. Prognosis: most people with hepatitis A recover fully within a few weeks to 2 months. The virus does not cause chronic liver disease, and once recovered, individuals are generally immune to future infections. However, it is important to follow medical advice and take measures to support liver health during recovery. Conclusion: hepatitis A is a preventable viral infection that affects the liver and is usually self-limiting. Vaccination, good hygiene practices, and safe food and water consumption are key to preventing infection. If symptoms of hepatitis A occur or if there has been potential exposure to the virus, seeking medical attention is important for diagnosis and management.